Here's what you should know about vaginal yeast infections. I'm Dr. Esther Chin, an obstetrician-gynecologist and assistant professor in the Department of Obstetrics and Gynecology at McMaster University. Vaginal yeast infections are a common infection that affects 75% of people at least once in their lifetime and is most often caused by Candida albicans. Factors that increase the risk of vaginal yeast infections are sexual activity, recent antibiotic use, pregnancy, and having an immunosuppressive condition. For example, poorly controlled HIV infection or diabetes. Common symptoms of vaginal yeast infections include a thick cottage cheese-like discharge associated with vaginal, meaning the inside, or vulvar, so the outside, itching, burning, pain, redness, or swelling. It's also possible to have external pain with urination or pain with sexual intercourse. A common misconception about vaginal yeast infections is that the area needs to be cleaned more, but this can actually cause more irritation. In fact, there are multiple factors that may lead to a symptomatic yeast infection, including a combination of how susceptible that person is, that person's inflammatory responses, and how aggressive that particular species of Candida is. For any irritation of the vagina or vulva, using different toiletries and products, including douching, can actually irritate the tissues more and disrupt the normal pH and/or flora, thereby increasing the risk of various infections. Therefore, in general, if someone is experiencing vaginal or vulvar irritation, we recommend avoiding douching and avoiding all perfume products such as soaps, shampoos, bath oils, bubble baths, hygiene sprays, moisturizing lotions or creams, laundry detergents, and fabric softeners. We also recommend washing the vulva only with water, wearing cotton underwear and loose clothing made of natural fibers to allow for better air circulation, using cotton, unscented sanitary napkins or tampons or other products, and ensuring that these products are changed frequently. Using these products only while menstruating, as daily panty liners may cause irritation, and avoiding shaving or waxing the vulva, as this can cause irritation. If you think you have symptoms of a yeast infection, it's important to reach out to your primary healthcare provider for diagnosis. Treatment for uncomplicated yeast infection is typically only necessary when there are symptoms, because more than 20% of people may have yeast as a part of their natural vaginal microbiome, and the majority may be asymptomatic. By increasing awareness of vaginal yeast infections, we can normalize discussions of gynecologic health, reduce stigma, and ensure that everyone affected gets the support they need for this treatable condition.